The gentleman from Henrico, Mr. O'Bannon.
Mr. Speaker, I rise to request a point of personal privilege, please.
The gentleman may proceed.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, Sunday is coming. And what I'd like to do today is take a minute or two to talk about our budget. Chairman Jones, the Appropriations Committee, last week previewed for us some of the things we might expect to see. I want to thank him for his leadership, Delegate Landis, all the staff. I think they do a great job. Yesterday, we heard the gentleman from Lynchburg talk about how we will save $10.2 million in tax or fee increases for Virginians. And today, what I'd like to do is talk a little bit about our budget as it relates to our health care efforts to strengthen our health care safety network here in the Commonwealth. Now, most of us were here last year. We had that passionate, lengthy debate over expanding Medicaid under the Obamacare plan. I remind everybody that we voted 3 times as a body, and we voted against expanding Medicaid. It was very clear then, and it's very clear now that that was the right decision, and that was affirmed when I went back home over the off season and talked to the folks that I represent. In September, Governor McAuliffe rolled out his Healthy Virginia plan. At that time, I think, Mr. Speaker, you said the House would review that plan during this session of the General Assembly, and that's what we've done. Some of us had umbrage with the way that was done. The Medicaid Board called a meeting, they declared an emergency, and then they set a new program into place. Now, Chairman Jones and Delegate Stolle, a couple of weeks here on the floor, discussed some of the details of that plan and why we thought that maybe wasn't the best way to go. You may remember, this is seriously mentally ill folks. This was a, quotes, bare bones policy. It was around $8,500. When that ran out, they were cut off. There was no hospital coverage in that plan, roughly 20,000 people. We heard Delegate Stolle and Delegate Jones talk about some of the problems we felt with that. And also Chairman Jones talked about what the House did, what we did last year in our efforts to improve the safety net. We all lived through the Gus Deeds tragedy. Last year, we put $54 million of new money into the mental health care, 24 new drop-off centers, 4 new PAC teams, $1.5 million in children's mental health service, $54 million for mental health. What I'd like to do today is share just a little bit with you about what we'll be seeing on Sunday. And I'm proud to tell you that the House budget will contain nearly $125 million in funding for mental health coverage and targeted safety net services for truly needy Virginians. Let's be clear. We are not expanding Medicaid. We're not funding the plan specifically that the governor put out. Our budget will strengthen the existing health care safety net for the truly needy. We're building on our priorities. We're using real dollars, not promises from federal funding, for the most pressing needs of our most vulnerable Virginians. Here's what we'll be doing. We'll provide targeted behavioral health and substance abuse treatment for Virginians with serious mental illness. We'll cover those folks that are at the current Medicaid level, 80% and below. But what this will do will be allow us to cover almost 30,000 people, not 20,000. They will get case management, care coordination through the existing provider networks. There'll be a prescription drug benefit with no cutoff if the money runs out, as in the other plan. And it's a much more comprehensive approach to care that will meet the needs of this vulnerable population. Mr. Speaker, this plan will nearly double the operational funding for our free clinics and community health centers. Our free clinics and community health centers do a great job. By funding these centers, we are increasing the access to primary doctors and preventive care without creating a massive new entitlement program. Our plan will continue to build and invest in community behavioral health services. 2 new PAC teams for a total of 25 across the state, 5 new drop-off centers for a total of 29. And those of you all in the business know these are the things that do the most good for this vulnerable population. We also additional funding for children's psychiatry to reduce the wait times for that. So, Mr. Speaker, Sunday, The takeaway share will be that we're strengthening the safety net for the truly needy people in Virginia. We're increasing access to services without a new government program. We're using real dollars, and this will help the people in Virginia who really need it. Thank you, Mr. Speaker.
Thank you.